different genes, or entirely different genes than what causes type 1, but they've got genes that enable them to get type 2 diabetes. And then the major thing that happens is that they get overweight or obese. And that causes those genes to make them, are they deficient in insulin? Do they have insulin still in their body?
Yes.
Yeah. Otherwise, they have to take insulin. Some of them do have to take insulin over time. Their beta cells can fail, not from an immune process, but from just a process of inflammation and just damage to their beta cells. So, but most of what they really have is they're resistant to the insulin working in their body. So they can take those pills. That's what the pills do. It makes them less resistant to insulin. So the insulin can act, and they don't necessarily need to take it. Can it be prevented? Absolutely. We've got studies in the U.S., in China, and in Finland that definitively show somebody who's at high risk to develop type 2 diabetes, if they got active, if they ate right, if they lost weight, they won't necessarily end up developing type 2 diabetes. So they can prevent it. Their treatment, lifestyle, those pills, glucose-lowering medications, including insulin, and now the one thing that we've shown can cure type 2 diabetes is bariatric surgery, which means it's the surgery that people have when they're obese, and we move their guts around so that they don't absorb all their food, and then they lose weight, and then they change